Hello, and welcome to H&HN's continuing coverage of the 2013 Most Wired Survey. I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Susanna Hopsahlern, H&HN's Senior Editor for Data and Research, to look at some of the changes to the annual survey, which helps hospitals and health systems measure their progress in the implementation of health information technology. Susanna, thanks for joining me today.
Thank you, Hayden.
So, Susanna, I'd like to get started. Can you run us through some of the key changes to the 2013 Most Wired Survey?
Hayden, this is our 15th year of running the Most Wired Survey and benchmarking tool. And this year, in the infrastructure section, we've added some capabilities in terms of protecting the patient information. And particularly as more folks are bringing in their own devices, there are some added capabilities for mobile devices to protect the personal health information. Another concern that's come up is that when information is no longer needed, that it's discarded properly. So there are also remote data wiping capabilities that some organizations are implementing. There's also an emphasis now on, while the patient is actually in the hospital, using communication tools, getting them engaged in the care plan, and having them access their own medical record while they're in the hospital. And we also worked very closely with the VA this year on beefing up our emergency management capabilities, because as you know, so many parts of the country have experienced disasters, and we want to make sure that they have the capabilities in place to be prepared.
And Susanna, I'd like to go back to one of the areas you mentioned. How is the Most Wired Survey addressing the use of EHRs to manage care coordination and system integration initiatives?
In that area, we're looking at those clinical analytics that are being very carefully looked at the department level and at the enterprise level. We also are looking at population health metrics, the use of electronic health registries, as well as really analyzing what's going on across the care delivery system and the communications. Now, we've seen already some of this being used in very sophisticated ways. It's taking process management and care management to a whole new level. In the emergency department, we saw this past year that Peninsula Regional Medical Center had used some of those analytics and also then hardwired some processes to improve sepsis care, saving lives and a lot of money. And then we also saw Vera Health deploying some of this technology to create an e-hub for emergency care in a rural network. And there we were able to prevent transfers of patients that would be best served in the local community. So quite a few organizations are leading the way and already using some of these sophisticated analytics to improve their processes.
And finally, Susanna, how does the survey analyze the use of big data strategies and systems?
Well, what we're seeing is that there's a use of business intelligence tools to do nowcasting as well as scenario planning. So as hospitals are adding on not just other hospitals, but physician practices, clinics, post-acute care facilities, they're able to use some of these advanced tools to really just in time see how is it going to affect the care of the patient across the continuum.
Well, Susanna, thanks so much for joining us today.
Thank you.